Okay. Good afternoon, ma'am. I'm Nicole Seganyaras and I'm your student nurse for today. So what I will do po is I will check your head to toe health assessment and history taking po for your wellness check-up. Is that okay with you, ma'am?
Oh, yes. Okay.
So, before we start, naiihi po ba kayo or meron po kayo ibang gustong gawin?
Wala na po.
Okay. So, please tell me kapag po meron po mga bagay na hindi po kayo comfortable para kumain agad natin while doing the health assessment. So, now we have the permission of the patient. Now we will gather all the equipments needed and then perform hand hygiene. So, after that is we will proceed to the overall health assessment checkup for the patient. We will proceed to the health assessment checkup of the patient. So, by observing the appearance of the patient is well groomed and is dressed appropriately to the weather and condition, and is sitting in an erect position and on the edge of the bed. So, now we will assess the mental status of the patient by asking questions and first for the level of consciousness. So, ma'am, alam niyo po ba ang date po ngayon?
Opo.
Ano po yung date natin ngayon?
May 17, 24.
Ano po araw ngayon?
Sunday.
Okay. So, alam niyo po ba ang current president natin ngayon kung sino po?
Ay, opo. Si President Rodrigo Roa Duterte.
Nasaan po kayo, ma'am, ngayon?
Dito po ako sa bahay. Dress po namin. Parang baga.
So, the patient knows the time, place, and the date, the place, and person. So, the patient is aware of that. Only a happy face, ma'am, sad face, and an angry face. Ayan. So, the patient can follow instructions and can express feelings and emotions. Ngayon po, I will give some scenarios kung and I will ask kung ano po yung inyong initial reaction sa scenario na yun. So, halimbawa po, ay napunta po kayo sa isang madilim na lugar and merong biglang mga aso na dumating na tinahanan kayo, ano po yung initial reaction niyo?
Normally talaga, natatakot ako sa aso. Ngayon, pag naandun ako sa isang madilim na lugar, at nagtaho lang yung mga aso, unti-unti, ay, ang gagawin ko, dahan-dahan akong lalakad ng walang ingay para hindi nila ako mamamalayan hanggang sa mabilis ako makalis doon sa lugar na yun.
Okay. So, can you explain po, ma'am, kung ano po yung pananaw sa kasabihan na health is wealth?
Yan po talaga ang isang kasabihan na pinapaniwalaan ko. Kasi po, kung tayo malusog, wala tayong gagastos sa pambili ng gamot. Kumakain tayo, nakakatrabaho tayo, nakakapag-serve tayo sa family. Wala tayong ibang expenses, kundi mag-serve. Magagawa natin, ang gusto natin, makakapamasyal. So, kapag ako may sakit, ayan, wala akong ganang kumain. Papakainin nila ako ng papakainin, bibili ng pagkain, hindi ko naman pala kakainin, so sayang. Bibili ng gamot, tapos ilang araw pa ako hindi gagaling, hanggang sa ako nakonfine sa hospital, kung hindi pa ako mabuti, mas lalaki yung gastos. Kaysa yung wala naman akong sakit at ako'y malusog, ay napakalaking kayamanan.
Okay. So, the patient can relate to some scenarios. Her cognitive abilities is in good state. she can respond well. And so now after that is we will now proceed to the skin assessment of the patient. So by observing the exposed parts of the skin of the patient, there is no lesions or swellings detected, and upon palpation, the skin turgor of the patient is intact, and the color of the skin color is light brown. And we will proceed to the head and face assessment of the patient. So by observing, the head of the patient is asymmetrical to the body, and the shape of the face is round, and the hair distribution is evenly distributed. And then, so now ma'am, I will ask you to close your eyes, and I will touch certain parts of your face, and you will tell me kung left or right po ba yan. Okay po? Right.
Will I close my eyes? Left, right, upper,
Side.
side,
Side.
left side, upper right.
Okay. So the patient's cranial nerve number 5 is intact. Show me a happy face once again, ma'am. And can you raise your eyebrows? Show your teeth. So yeah. The cranial nerve number 7 of the patient is also intact and in good condition. So I will ask you, ma'am, to open and close your mouth. Close. So the temporomandibular joint is intact also, and there is no tenderness or swelling upon palpation. So now we will proceed to the eye assessment for the patient. So assuming that we have this Snellen chart, we will use it to check the vision of the patient with her eyeglasses on, and then after that is we will use the ophthalmoscope to check the eyes of the patient, and then after that is we will perform a corneal reflex. So can you remove your eyeglasses now? So the cranial nerve number 8 for facial is also intact, and the corneal reflex of the patient is good. The cranial nerve number 7 of the patient is intact and in good condition. So we will then check the outer extremities of the eyes, and the eyebrows is in black color and is evenly distributed. The eyelashes is evenly distributed also, and the color of the iris is dark brown, and the conjunctiva is pale white. So now we will proceed to the ear assessment of the patient. So assuming that we still have the otoscope, we will check for the inner extremities of the ears, check for the eardrums or the tympanic membrane, and the color inside, if there is a earwax or and then after that we will check for the auricle. It is tender and it is intact, elastic, and there is no tenderness or swelling. And now we will check the hearing of the patient through whisper test. So I will ask you, ma'am, to close your eyes, and I will whisper some words, and you will tell me what those words are. So I will start.
1, 2, 3.
Okay. Next, on the other side.
1, 2, 3.
Okay. So the appearance of the ears and the hearing of the patient is in good condition, and there is no problems in the hearing detected, and there is no problem in the appearance of the ears detected. So now we will check the nose and sinuses of the patient. So first is we will check the appearance of the nose. It is intact and there is no swelling or lesion or tenderness detected. And assuming that we have used an otoscope, we will check the inner extremities of the nose. So after that is we will ask the patient to close her eyes and we will direct some object to her, and she will tell what object it is by smelling it. So can you close your eyes now? Can you tell me what do you smell?
I smell coffee.
Okay. And then how about this now?
It smells, I guess it's alcohol.
Okay. So, the nose and sinuses of the patient is in good condition. She can determine what object she is smelling, and the appearance of her nose and sinuses is in good condition, assessed with the mouth and throat of the patient. So we will ask the patient to open your mouth now and say ah. So the tonsils doesn't have any lesions or swelling. The tonsils doesn't have any swelling, and the uvula is in the middle. Okay, you can close your mouth now. And then we will check for cranial nerve number. So assuming that we have a clean gloves, we will touch the soft palate of the patient, and then we will check for gag reflex in the uvula. And then after that, we will check the cranial nerve number 12 by checking the patient if she can assess the taste that of the something that I will place on her tongue. So I will ask you, ma'am, to close your eyes, and you will guess what is it that you taste. Okay, open your mouth now. What is it, ma'am? Kape. Tapos asukal dun sa
Hindi naman malasa.
kasi hindi ko mailagay. So we will now check the cranial nerve number 12 of the patient by asking her what is the taste of this. So close your eyes, ma'am. Yeah.
Damihan mo kasi.
Ilalagay ko na po.
Ako pa yan.
Kape ko sa asukal.
Wala kasi doon sa dulo.
Ilalagay ko. Close your eyes, ma'am, and open your mouth. Can you guess it?
Is it coffee?
Yes, correct. Correct. So next is other one.
So sweet. Is it sugar?
Okay. So the cranial nerve number 12 of the patient is intact because she can decipher what is the taste of the objects such as the coffee and the sugar. And then we will then check for the cranial nerve number 10 of the patient, which is the strength of the tongue. So I will put this on your tongue and you will press lalabanan. Okay. So the cranial nerve number 10 is also intact. We will proceed to the neck assessment and we will check the range of motion. So can you face here, ma'am? Here. And then upward, downward. Can your ears touch your shoulders like this? Okay, on the other side. So, the range of motion of the patient's neck is good. Now we will proceed to the lymph nodes. We will palpate the lymph nodes to check if there is tenderness or swelling. So the preauricular, the postauricular, and the tonsillar, submandibular, and submental nodes, the supraclavicular, and the post-cervical, the deep cervical chain, and then the supracervical chain, and then the occipital chain. So, upon palpation of the lymph nodes, there is no swelling or tenderness upon palpation. Okay, tigil ko. Ang liwanag mo na. Parang man. Ayan. Ayan. Hindi pa.
Yung po mo, isampay mo dyan. Oh.
Ito na.
Spotlight.
Ayan. Sunod. Trachea. Ay, naka-on na to.
Naka-on. Naka-on. Taas mo.
Now we will check the trachea of the patient. If it is in the, so ayan, the trachea of the patient is in the midline, and we will approach the patient on the posterior side to check for the thyroid gland. Ayan. So the thyroid gland of the patient is intact, and it is in the midline, and there is no tenderness or swelling detected upon palpation. And then we will then auscultate in the auscultate in the thyroid gland first, and to detect if there is sound of bruit.